In 2025, if your desire is to remain in good health, there are various tests I'll mention today. You need to go and check yourself to ensure you are in optimal health, and also know when to start early intervention in order to prevent disease breakdown. The first one is full blood count. In full blood count, different type of anemia is ruled out, and also blood infections are ruled out, and many other things. So these things, when ruled out early, can be treated, and when ruled out late, cannot be treated. So you should always check this full blood count. The next one is high blood pressure. That is monitoring your blood pressure. Many young people are coming down with high blood pressure, and this has increased the incidence of kidney diseases. So most people now, especially young people, are coming down with this high blood pressure. So if you have not monitored your blood pressure for the first time, please do that this year and know your values. Once a higher value is obtained, monitor it closely. If it appears 3 consecutive times, that is, you have checked and checked and checked up to 3 times and it's still the same, please go to your doctor for proper medication and support. The next one is diabetes. That is monitoring your blood sugar levels. Then do a fasting blood sugar this year to know the mark of your blood sugar level when you are fasting. That is when you have not eaten anything in the morning. You should check your blood pressure, your blood sugar level, to know whether it's high or low or in a normal range. Anything above 130 should be evaluated by your doctor. So the next thing you should do in 2025, that is the test you should do in 2025 to avoid breakdown, is kidney function test. Know how your kidney is working in 2025. The first thing, go to the hospital, obtain a kidney function test. This can show you the extent of the electrolytes in your body, what they are doing, and how they are affecting your kidney health. So do that in 2025. Then the next one is obtain a liver function test. This liver function test can help to rule out diseases like hepatitis and the rest of them. So once a liver enzyme is elevated, further tests can be done to know what is causing that liver enzyme to be elevated and be treated early, so that to avoid body breakdown later. Then the next test you should do in 2025 as a woman is your pap smear. Ensure you do pap smear this year to rule out cervical cancer. Then the next thing you should do as a woman is, or as a man, before treating an infection this year, is to do a culture test. Don't just pop antibiotics into your mouth this year. Stop it. Stop it. It is not, antibiotics cannot be used as a contraceptive pill. Please stop it. Once you feel that that you need your body to be checked to know the proper antibiotics to use, go for a culture test to know the proper antibiotics you need to use. Then if you are a woman of middle age and you have not gone for mammogram to check, or you have this visible lump on your breast and you have not checked whether it is cancerous or just benign, do that this year by going for a mammogram. So all these things I've mentioned now are the tests that are needed for you to obtain a good health. Then the next thing you should do is to go for an abdominal scan. Abdominal scan will show how the internal organs are working, especially the kidneys. It will show the liver, it will show other parts of the body and tell you what is going on with them. So these are at least the basic tests you should do to avoid being broken in 2025. Also, do your viral screening such as hepatitis, your HIV screening, to know your status at least this year. Don't just be going about. Some people have had this infection of HIV and they don't know. And what will now bring them to the hospital is maybe they are not urinating and they bring them to the hospital only to find out they have come down with kidney disease or kidney infection. From the investigation, they will now find that the root cause of this is HIV virus. So once you detect these things earlier, you are taking your medications, you can live a healthy and a longer life. Another test you need to go for is cholesterol test. You know that cholesterol is the one that is responsible for your heart health. So once you check and this cholesterol level is high, it can be treated early. So don't just be going about thinking that you are okay without proper checkup, because one thing in the part of this world is that we don't go for checkups and we suddenly fall ill, and you see they say this person fell ill and couldn't recover and died. This is as a result of not checking earlier enough to know what is going on. So if this video has added value to you, don't forget to follow me, like my videos, and share my videos. This is New Year. Don't just scroll. See you in my next video. Bye.